to BMS 227 News Channel. I'm Harriet and these are my co-hosts, Sefida. Hello. Sharon. Hi. And Cameron.
Good morning.
Today we'll be talking about human pain sensation, especially the growing problem of chronic pain in Europe on society and the economy. So first off, what is pain?
The Merriam-Webster Dictionary defines pain as localized physical suffering associated with bodily disorders. So how does pain work? Let's consider the scenario below. When walking around on her phone, Sepida accidentally bangs her knee into the chair and immediately felt a sharp pain. Dun dun dun. If we zoom in a little, we could see that the sensory fibers innervating the knee send signals to the dorsospinal cord, then up to the somatosensory cortex of the brain through the spinal thalamic tract. These sensory fibers contain pain receptors called nociceptors, which respond to mechanical, thermal, and chemical stimuli that are potentially harmful for the body. There are two main types of pain fibers. The lightly myelinated A-delta fibers are fast-conducting and thus are responsible for sharp pain. The unmyelinated C fibers, on the other hand, are slow-conducting, and they carry more delayed, diffuse, and longer-lasting pain. When Sepida bangs her knee, the excess mechanical stimulus sends in the sharp pain through A-delta fibers, while local release of agents such as prostaglandins following an injury sensitizes the tissues for longer-lasting pain carried by the C fibers.
Pain is a normal occurrence in the event of injury. However, chronic pain is consequential in some conditions such as arthritis and herniated discs. Chronic pain is defined as a long-lasting pain lasting more than 12 weeks and is very prevalent in Europe, with an average of 90% among European countries. The annual cost of chronic pain on the economy is around $600 billion in the US and $300 billion in Europe. This figure is 3 times as high as the cost of cancer.
Did you like the molecular lecture just now?
No, I hate gene evolution. It just gives me a headache.
Oh, headache. Do you want some paracetamol?
Did someone say paracetamol? Now we can tell you so much about paracetamol. To science!
So Harriet, tell me more about paracetamol.
Well, paracetamol is an NSAID, and NSAID is a non-steroidal anti-inflammatory drug. They block COX enzymes, and COX enzymes, they produce prostaglandins. Now, prostaglandins, they decrease your action potential threshold, which increases pain sensitivity. Now, this is bad if you're in a bit of pain, so, yeah, NSAID stop all that, and it'll be all great.
Oh.
So, Sepida, are there any other drugs?
Well, Harriet, I'm glad you asked. There are currently other treatments, such as opioids and immunosuppressants. Morphine is for chronic pain, however, cyclosporin is for
Autoimmune diseases?
Yes, well done. So, there are some side effects.
Yeah, we can ignore the side effects. There's no dizziness or nausea or respiratory distress at all with NSAIDs. So, buy our product, Cyclohydroxycyclotriglyceride and Cyclo.
Buy it.
Buy it now.
Buy it.
But chronic pain isn't the only problem. There are other rare diseases involving pain, such as congenital insensitivity to pain and somatic symptom disorder.
So what exactly are those?
Well, Sharon, some genetic mutations can cause insensitivity or hypersensitivity to pain. For instance, autosomal recessive loss-of-function mutation in the SCN9A gene results in a non-functioning voltage-gated sodium channel 1.7, which are found in the nociceptive neurons.
These patients can feel the difference between sharp, dull, hot and cold sensations, however can't actually feel pain or notice any feeling of discomfort at the extreme of these sensations, suggesting that only the nociceptors are affected while touch and chemoreceptors are not.
The condition itself isn't fatal, but many with the disease die at a young age due to accidents. As they cannot feel pain, they don't know when they have broken bones or injured themselves, which can be a serious problem if it goes unnoticed. On the other hand, autosomal dominant gain-of-function mutations in the SCN9A gene can lead to hypersensitivity to pain, causing symptoms such as redness, heat, and burning pain.
Wasn't there something also mentioned earlier about somatic symptom disorder?
Well, Sharon, somatic symptom disorder is another type of pain disorder. However, it is quite different from the ones mentioned before. It is classified as a mental disorder. This is largely due to the fact that the patient perceives distress or pain when there is no physical injury or illness.
As you could imagine, unpleasant sensations as such may cause disruption of mood, behavior, and normal functioning in the patient, and thus should not be easily dismissed by the GPs. Electroconvulsive therapy can be used to treat somatic symptoms, but not the disorder itself. On the other hand, oral acute sedation with benzodiazepines could tackle the disorder, but long-term use is not suggested due to adverse side effects.
What's in the future for pain disorders?
Fortunately, a novel treatment for pain is on its way. Botulinum toxin, more commonly known as Botox, is synthesized by a bacterium Clostridium botulinum.
It cleaves the SNAP25 protein required for neurotransmitter vesicles to fuse with the plasma membrane, thus blocking neurotransmission. However, Botox is not specific to nociceptors, and therefore can paralyze other neurons, causing complications such as neuromuscular disorders.
A 2013 study by Ferrari and colleagues found that a combination of Botox with tetanus, which specifically targets the central nervous system, exhibited analgesic effects in rats without causing muscle complications. This warrants further research in the search for the ultimate cure for pain. So, thank you for watching. This has been BMS 227 News Channel. That's all from us. Good night.
Goodbye.
Goodbye.
We'll see you next time.